Good morning and welcome to our weekly or biweekly briefing. In the past 2 weeks, Philadelphia and the surrounding counties continue to see a sharp uptick in cases of COVID-19. It'll be another week or so before we see the full effects of the Thanksgiving holiday on cases. But with the colder weather and recent spikes, and with the new variant of concern on the horizon, this is a time to be very careful. So here are our numbers. In the past 2 weeks, 3,174 Philadelphians have been diagnosed with COVID. As of yesterday, we're seeing an average of 258 new cases per day. And the percentage of tests that are coming back positive has increased to 4.8%. The situation around the world and in other parts of the country is becoming increasingly dire. Some countries in Europe have completely shut down due to the large number of people who are sick. Over the weekend, the Pan American Health Organization reminded us all that what happens in Europe usually happens in the United States a few weeks later. And already hospitals in states like Michigan and Minnesota are as full as they've been throughout the pandemic. In the last 2 weeks, we've seen more people wearing their masks in public, which is great, but the threat is real and increasing. We need people to not only wear their masks, but also to get vaccinated, to get tested, to isolate if you develop symptoms, and to limit indoor gatherings. For people who've gotten their vaccines, please get your boosters to help increase your protection and to decrease the risk to those around you. There may not be much time to get fully vaccinated or to get your booster before we hit yet another COVID peak. So currently, more than 93.2% of adults, 86.3% of those 12 and up, and 9.4% of children 5 to 11 in Philadelphia have had at least one dose of vaccine. We will likely have at least 75% of adults in Philadelphia fully vaccinated in the next few days. 74.8% of adults and 69.3% of those 12 and up are fully vaccinated. And more than 140,000 Philadelphians have had a booster dose so far. Those numbers are great, but they aren't high enough. As a reminder, everyone in Philadelphia over the age of 5 is now eligible to be vaccinated. And the CDC now recommends booster shots for everyone age 18 and up. Last week, we heard the first reports of a new COVID variant called Omicron that has been circulating initially, we thought, in South Africa. We're seeing it now in Europe, Asia, South America, and Canada. We have not identified any cases of the Omicron variant in Philadelphia yet, but this new variant appears to be more transmissible than the Delta variant. We don't yet know how this variant affects people who've been vaccinated, so we're watching developments very carefully. But our experience of previous variants tells us that the best protection against a new variant is to get as much of our population vaccinated as possible and to use layered mitigation strategies, meaning masks, avoiding indoor gatherings, and testing and isolation of those with symptoms to prevent spread. According to the World Health Organization, Omicron causes more reinfections than previous COVID-19 variants. That means that people who have had COVID-19 infection, who have not yet been vaccinated, may be at higher risk. The best thing we can do in the meantime is to keep doing the things that have protected us for the last 2 years. Get vaccinated, wear a mask, avoid crowded indoor spaces, and stay home if you're sick. If you are not vaccinated or you haven't had your booster yet, please avoid getting together with others indoors. Go for a walk with a friend or do a video call rather than having coffee together. Keep your mask on and consider double masking for added protection when you're indoors with others. And finally, evidence so far points toward this winter being a severe flu season, particularly for children and young adults. With many of our hospitals, including our children's hospitals, already at full capacity, we need to make sure that everyone, including all of our children, are protected against flu. So please get your flu shots along with your COVID vaccines. You can get them on the same day if you'd like. To wrap up, if you would like more information about the pandemic and the city's response, you can visit our website at phila.gov/COVID. If you have questions, please call our COVID call center at 215-685-5488. Now I'll turn it over to Zeli to present these remarks in Spanish. Thank you.
Buenos días y bienvenidos a nuestra sesión informativa semanal. En las últimas 2 semanas, Filadelfia y los condados circundantes continúan viendo un fuerte aumento en los casos de COVID-19. Pasará otra semana más o menos antes de que veamos los efectos completos de las vacaciones de Acción de Gracias en los casos, pero con el clima más frío y los picos recientes y con una nueva variante de preocupación en el horizonte, este es un momento para tener mucho cuidado. Estos son los números. En las últimas 2 semanas, 3,174 habitantes de Filadelfia han sido diagnosticados con COVID. Hasta ayer estamos viendo un promedio de 258 nuevos casos por día y el porcentaje de pruebas que están saliendo positivas ha aumentado al 4.8%. La situación en todo el mundo y en otras partes del país es cada vez más grave. Algunos países de Europa han cerrado por completo debido a la grande cantidad de personas que están enfermas. Durante el fin de semana, la Organización Panamericana de la Salud nos recordó a todos que lo que sucede en Europa suele suceder en Estados Unidos unas semanas después. Los hospitales en estados como Michigan y Minnesota ya están llenos como lo han estado durante la pandemia. En las últimas 2 semanas hemos visto a más personas usando sus máscaras en público, lo cual es genial, pero la amenaza es real y está aumentando. Necesitamos que las personas no solo usen sus máscaras, sino que también se vacunen, se hagan la prueba, se aíslen si desarrollan síntomas y limiten sus reuniones en interiores. Para las personas que han recibido sus vacunas, obtengan sus refuerzos para ayudar a aumentar su protección y disminuir el riesgo para quienes lo rodean. Es posible que haya mucho tiempo para vacunarse por completo o para obtener su refuerzo antes de que alcancemos otro pico de COVID. Actualmente, más del 93.2% de los adultos, el 86.3% de los mayores de 12 años y el 9.4% de los niños de 5 a 11 años en Filadelfia han tenido al menos una dosis. Es probable que tengamos al menos del 75% de los adultos en Filadelfia completamente vacunados en los próximos días. El 74.8% de los adultos y el 69.3% de los adultos mayores de 12 años están completamente vacunados. Y más de 140,000 habitantes de Filadelfia han tenido una dosis de refuerzo hasta ahora. Esos números son excelentes, pero no son lo suficientemente altos. Como recordatorio, todos en Filadelfia mayores de 5 años ahora son elegibles para vacunarse. Y la CDC ahora recomienda vacunas de refuerzo para todas las personas de 18 años en adelante. La semana pasada escuchamos los primeros informes de una nueva variante de COVID llamada Omicron, que ha estado circulando en Sudáfrica. Algunos lugares de Europa, Asia, América del Sur y Canadá ya han visto casos de esta nueva variante. Todavía no hemos identificado ningún caso de la variante Omicron en Filadelfia, pero esta nueva variante parece ser más transmitible que la variante Delta. Todavía no sabemos cómo afecta esta variante a las personas que han sido vacunadas, por lo que estamos observando los desarrollos cuidadosamente. Pero nuestra experiencia de variantes anteriores nos dice que la mejor protección contra una variante es vacunar a la mayor parte posible de nuestra población y usar estrategias de mitigación incapaz. Es decir, máscaras, evitar reuniones en interiores y probar al aislamiento de aquellos con síntomas para prevenir la propagación. Según la Organización Mundial de la Salud, Omicron causa más reinfecciones que las variantes anteriores de COVID-19. Esto significa que las personas que han tenido la infección por COVID-19 que aún no se han vacunado pueden tener un mayor riesgo. Mientras tanto, lo mejor que podemos hacer es seguir haciendo las cosas que nos han protegido durante los últimos 2 años: vacunarse, usar una máscara, evitar espacios interiores abarrotados, quedarse en casa si está enfermo. Si no está vacunado o aún no ha tenido su refuerzo, evite reunirse con otras personas en interiores, salir a caminar con un amigo o hacer una videollamada en lugar de tomar un café juntos. Mantenga su máscara puesta y considere el doble enmascaramiento para mayor protección cuando esté en interior con otras personas. Y finalmente, la evidencia hasta ahora apunta a que este invierno será una temporada de gripe severa, particularmente para niños y adultos jóvenes, con muchos de nuestros hospitales, incluidos nuestros hospitales infantiles, ya a plena capacidad. Debemos asegurarnos de que todos, incluidos todos nuestros niños, estén protegidos contra el gripe. Así que, por favor, reciba sus vacunas contra la gripe junto con sus vacunas COVID. Puede recibirlas al mismo día si lo desea. Para concluir, si desea obtener más información sobre la pandemia y la respuesta de la ciudad, puede visitar nuestro sitio web en phila.gov/COVID. Si tiene preguntas, llame a nuestro centro de llamadas COVID al 215-685-5488. Thank you.
Thank you very much, Zelly. We'll now move to the question and answer portion of our program. If you have a question, please use the raise your hand function, and we'll take those questions in the order received. As usual, we ask that members of the press coordinate internally to keep their questions focused on the COVID-19 pandemic. If there are any reporters who do not get the opportunity to ask a question or have questions about other topics, please follow up with us by email and we will get you an answer. First up, we'll go to Deanna Durante from Channel 10. Should be able to unmute now.
Good morning, thank you. You mentioned the hospital case in the Midwest. I was curious if you're able to tell us what local hospitals, specifically in the city of Philadelphia, are seeing in terms of cases needing hospitalization. And also, I see information from the city on required masking for those working in the Head Start programs. And we're also hearing that the masking and required vaccines are causing people to flee and leave to other employers. Any concern that people, when they see these, will not heed the warnings and leave for other jobs?
So On hospitalization, Philadelphia area hospitals have seen some increase in patients over the past month, not nearly as severe as what's being seen at West. The much larger problem with Philadelphia hospitals right now is that they are very full of people with other kinds of problems. So, we've seen, for example, and heard from our children's hospitals that because of mental health among children, they are seeing very large numbers of children. And then RSV, other kinds of illnesses not related to COVID. It's just that when hospitals are 100% full, any increase can really be a real problem. And, when we talk about, for example, hospitals, not in Philly, but, this could happen here, having to stop elective procedures. Elective doesn't mean we decided to do it for fun. It means we didn't have to do it today, but often those are procedures that are important and necessary for the people who are scheduled to have them. So delays in needed services are something we would take seriously. So we're not in crisis mode in Philly, but we're trying to stay out of crisis mode. In terms of the Head Start programs and their requirement for masking and vaccines, time and again, well, firstly, we have a mask mandate in Philadelphia and have had a mask mandate in Philadelphia since August and have not seen anyone fleeing because of it. In general, vaccine mandates have not caused people to flee their jobs. And, we've seen lots of dire predictions on that here in Philadelphia and around the country. In general, it has not been true. Very, very small numbers of people don't get vaccinated. There are always a few who get exemptions, but job loss fleeing to somewhere else just hasn't turned out to be a problem.
Then if I could just follow up, you say we're not in crisis mode, but if we start to see the uptick or we're concerned about hospital cases, whether there are other illnesses stressing the medical system, do you foresee or are there talks of stronger mitigation efforts, more, not indoor gatherings, reducing gatherings, going back to what we saw a year ago?
So in general, because we now have effective vaccines and we know how effective masking can be, we have chosen to use vaccine mandates and masks over closures and capacity limits. I can't promise that will continue to be the case. We don't know what's coming with Omicron. So, my ability, I've said this before, to predict the future is not great with this pandemic. But I can say that we would choose vaccine mandates and masking over more economically damaging measures to the extent that those can succeed.
Thank you. I think I reached my limit.
Thank you very much, Deanna. Next up, we'll go to Johan Calhoun from Chalkbeat. Johan, you should be able to unmute now.
Good morning. Thanks for having me. I need clarity on numbers. What's the percentage of persons between 5 and 12 who have received the vaccine? And with the Omicron variant, are there worries that we need to increase that number? So
we are worried and really trying hard to increase the number. Currently, based on our Philadelphia data, we are at 9.4% of 5 to 11-year-olds vaccinated. We break it down that way. 12 to 17 is a separate category. We are waiting for the analysis of the data we just received from the state, so that may go up slightly. But we have a lot of work to do in terms of vaccinating children at this stage.
Okay, and what's the number between 12 and 17?
The percent?
Yeah.
I can get that for you. So I'm sorry. Do you want fully vaccinated or one dose?
I'll take both.
12 to 17-year-olds fully vaccinated, we are at 41%. And with at least one dose, we are at 51%. And all of that data is available on phila.gov.
Okay, and let me ask you this. What efforts will the city provide to make sure that all Head Start staff be fully vaccinated by January 31st?
So we did a big push to offer vaccine to early childhood educators, Head Start, and teachers in general, very early in the vaccination effort. So many of them have been vaccinated, but we have vaccine available at more than 350 locations in the city, and would really encourage people to take advantage of that, whether they're at Head Start or in another occupation. But vaccine is now readily available in Philadelphia.
Okay, thank you.
Thank you very much, Johan. Next up, we're going to go to Laura McChrystal from the Inquirer. Go ahead, Laura.
Hi, Dr. Medical, you said that you would, favor vaccine mandates and masking to the extent that they can succeed. Could you tell us sort of is there a metric you would look at as to what would push you to say we need more to mitigate this?
So we're looking at cases and hospitalizations. With Omicron, we're also looking to see what the vaccine efficacy is. So we're expecting there'll probably be some decrease in efficacy of the vaccines against Omicron, but will it be 85 or 80%, or will it be substantially lower than that? So we should have that information within the next few weeks. We'll be watching that carefully, but also watching to see if we see a very slight uptake from the holidays, or if we're really seeing a sharp increase.
Okay, and for vaccinating children between the ages of 5 and 11, you said that there's a lot of work left to do there. I'm just wondering, is the pace so far of that, is it what you expected, going slower, going better?
I think that we saw, in the first days after a vaccine was available for 5 to 11-year-olds, we saw the parents who were very eager come right out and get those vaccines. And we knew that for the rest of the city, we were likely to need to do a fair amount of work there. We've seen data for the last few months saying that parents are a little bit more hesitant to vaccinate their children in general than themselves. So we have crews and our community partners have crews around the city sharing information, running vaccine clinics, particularly in lower vaccinated neighborhoods. There's partnerships with city schools. There's a lot of different efforts around the city, really focusing in the lower vaccinated neighborhoods to try to get vaccine out. But it is going to take a fair amount of to get there. And I think one of the things we've seen with earlier parts of this vaccine effort, there's sort of a tipping point where people start to know other people who have done this. So the work is hard initially and gets a little bit easier once people have friends, neighbors, relatives who've had their kids vaccinated. So it's a little bit of a kind of snowball method of trying to reach as many people so that they can also reach their contacts.
Okay, thank you.
Thank you very much, Laura. Next up, we'll go with Pat Loeb from KYW. Go ahead, Pat.
Dr. Bedigal, have you seen any progress since you instituted the vaccine mandate for city workers? Are higher percentages of city workers getting vaccinated?
Yes, the numbers are going up, and those are on the website as well.
Okay, and I heard Zeke Emanuel from Penn say, or I think at least agree with the statement, that we're not doing enough sequencing of test results to see what kind of variants are abroad in the land, so to speak. So could you talk a little bit about what the city does to try to figure that out?
Yeah, and I would definitely agree with that statement. The US as a country doesn't do nearly enough sequencing. And I think we saw with Omicron, South Africa announced it first, but it appears in Europe first. So very few cases in the US overall are sequenced. I have actually been talking with our lab director about building a sequencing unit within the city's public health lab, because this feels like a very, very important capability for us going forward. And she's working on that. In Philadelphia, the University of Pennsylvania and CHOP both do sequencing, and we are in close communication with them. Omicron has not been found in Philadelphia at this stage, but it is likely to spread, and sequencing gives us more of a head start on knowing what's coming and when.
Thank you, that's all.
Thank you very much, Pat. Next up, we'll go to Brian Mendoza from Telemundo. Go ahead, Brian.
Hi there, good morning, everyone. No sé si pueden traducir esta pregunta para tenerla en español. Celi, si le puedes preguntar, ¿qué está haciendo la ciudad para determinar si hay efectivamente casos o no de la variante Omicron aquí en Filadelfia? ¿Se están usando diferentes tipos de test, o cómo se está tratando de determinar que no haya llegado aquí a la ciudad?
Repite, por favor.
Sí, ¿qué está haciendo la ciudad o el Departamento de Salud específicamente para determinar si la variante Omicron no está aquí efectivamente? ¿Se están usando diferentes tipos de exámenes, de pruebas, o cómo se está determinando si esta variante no está aquí?
Okay, so what is the city doing to determine whether the variant Omicron is here in the city, and what are we doing to prevent it?
Are there any specific tests being used, or what's being done to determine that effectively it's not, the variant's not here?
Yeah, so the sequencing in Philadelphia, as I mentioned, is largely done by the University of Pennsylvania and CHOP. We also have the ability to send samples to the CDC for sequencing, but generally speaking, it's faster to get it done locally. That said, it's only a minority of strains that are sequenced. So I think it is very likely that we'll start seeing it spottily around the United States relatively soon. I don't think that we should anticipate being able to prevent Omicron from coming to Philadelphia. People move around, they have the right to move around, and it likely will come. So what we want to do is to protect our residents as well as possible. And that means vaccine, it means masking, it means people thinking carefully, each of us taking the responsibility to think carefully about whether we go to indoor gatherings, whether we go to places where there are lots of people together indoors, especially if we're not vaccinated, because that's how this can spread. And if you do go somewhere indoors, make sure you're wearing your mask.
Si quieres que traduzca esto, lo puedo hacer con electrónico, correo electrónico.
Ok, está bien. Sí, hablamos entonces después.
Sí. ¿Me mandas un correo?
Ok, está bien.
Gracias.
That'll be it. Thank you.
Thank you very much, Brian. Next up, we will go to Trish Hartman from Channel 6. Go ahead, Trish.
Hello, I have a question about testing. In your remarks, you mentioned that the percentage of those tests coming up positive has increased. Over the past few weeks, let's say, pre-Thanksgiving, have the number of tests, people searching out tests been going up? And then can you speak to, as we're dealing with Omicron and the holidays coming up, will the city increase its testing capacity as these tests might be more in demand? Thank you.
So we actually did not see a large increase in testing before the holiday, which we had anticipated. I'm guessing that means many people purchased home tests to use before the holiday. Tests were down last week. So I think part of the increase in positivity that we saw was likely that more of the people who were getting a test were experiencing symptoms. Positivity then may come down slightly. But in general, we are testing, in the range of 7,000 people per day. That is close to 0.5% of Philadelphians. We have been trying to increase testing, but I don't think we can increase much beyond that realistically, given the available staffing. So there's been a big push nationally to make home tests more available. And I think, cheap home tests will be an important component of this. We will also be working to get home tests out, especially to people through schools, families of school kids. But in terms of testing sites, I think 7,000 to 8,000 a day is probably close to capacity.
Just to follow up, the use of home kits, does that skew the city's data because the results are less likely to get reported back to you? How does that work when somebody tests at home versus going to a city site or a chain pharmacy?
Yeah, early on, the CDC was asking people to report their home results. They're no longer doing that. So yes, it definitely has an impact on our ability to gather data. That is the unfortunate side. That said, if everybody had a stack of home tests in their bathroom and could do one before they went out to meet with other people, I think we would have less transmission. So we give up something in terms of our ability to do surveillance, but we gain a lot in terms of just preventing spread.
Thank you.
Thank you very much, Trish. So that we are now over time, so I want to thank everyone for joining us today. As a reminder, we've moved this press briefing to a bi-weekly schedule and plan to see you all again on December 15th. Thank you all again very much, and that'll conclude today's press briefing.